After wasting valuable weeks, the United States and Europe are in for a very rough ride. Hello, everyone. This is Chris Martinson. I'm here with your SARS-CoV-2 update for March 10th, 2020. And I wish I could be a little bit more... I wish I had better news. It turns out that when you're facing a pandemic, every moment counts. For those of you who managed to listen to my words and prepare, thank you for doing that, and you're going to be really glad that you did coming up. So let's go through the numbers real quick, and I'll tell you why I'm talking about things the way I am right now. This is going to be pretty tough to get through. So first up, Italy is now over the 10,000 mark, and over 600 deaths, another 168. And this is just going to show you what happens in a country where they're a little slow on the draw. Italy wasn't shutting down its borders, wasn't shutting down its travel. I'm not going to fault Italy because many countries are taking that same approach. I mean, I'll fault them, but they all have to be faulted equally. Nothing special in Italy's case. They had leaders who are more interested in preserving a few extra bucks on some temporary economic gain rather than understanding exactly what was going on from a health perspective. Iran, again, just getting lots and lots of data out of Iran that they have maybe a couple million or more infections at this particular point in time. South Korea, though, this is the good news because that's amazing. Only 35 new cases, and this is with very, very aggressive testing. So South Korea, and they're not even on this chart anymore, of course, Singapore and Taiwan, all showing us exactly what you need to do and how you can control this thing. It is controllable, but you have to put human life above saving your stock market or whatever your economic considerations are. That has to come first. So at any rate, as we look through these, remember I told you that this page was going to be increasingly dominated with just triple digits. Look at Denmark here, racing in. Denmark did an especially poor job of containing this. Sweden's done a poor job. The Netherlands did a poor job. Switzerland's done a poor job. But the same poor job that the United States has done. And by the way, these numbers for the U.S. are completely bogus. And I'll show you why. I mean, the testing is still so far behind what is necessary that this number is complete junk right here. If you said the United States had, say, 100, had the same as Iran is reporting, had 100 cases out there, then you'd have to multiply this number by 50. So 35,000 or something like that, right? 3,500, yeah. Nope, 35,000. Got that right the first time. All right. So, but let me just show you where we're at. Let me switch screens here really quickly. I'm just going to use this live to go through this. Just join with me as we start looking down. We cut out the other one off at Denmark here, but look where this thing is now. Look where it is. Egypt, totally bogus numbers. Absolutely not. Still people are reporting coming out of Egypt and getting infected. So from a statistical standpoint, complete junk there, but it's pretty much everywhere in the world now and spreading. But just Macau's saying, nope, we don't have any more here. Maybe that's true, maybe not. But look at this. I mean, just scroll page after page after page. So it's everywhere. It's, the WHO is not quite ready yet to call this a pandemic, but that's beyond ridiculous at this point. So I want to take you through and compare and contrast, because what I'm hoping to do is encourage you, the listeners here. Some of you I know I've been contacted by, and I'm working with people who are administrators of hospitals. I'm going to be working with my own town council later this evening, and I invite everybody to do the same. You have the proper information. There are people out there who are in positions of authority and leadership who may not have the good information, or more likely, they're just really far back on the adjustment process. And just because they're having a hard time and they say they don't want to believe you, or you're nuts, or this is just the flu, or it isn't that bad, it's your duty, your responsibility, armed with this information, to get yourself as prepared as you can. And then as soon as that's done, start doing what you can to help other people get prepared, even if that's mentally prepared. So let's talk about the gold standard pandemic approach. The gold standard would include immediately halting all inbound infections. That's step one. You want to make sure that whatever you're dealing with, you're not adding to it by bringing it in from outside your borders. It's bad enough to have to deal with what's inside your borders. So you halt all inbound infections. This is from Flight Tracker. This is just something I pulled off a minute ago, literally showing the flights in the United States. So this could be people in New York City who are infected flying somewhere, or inbound planes from Europe, maybe from Spain, maybe from Italy. maybe from Germany, maybe from Denmark, who knows? But maybe with people who are infected. So as long as you keep doing that and you keep seeding your population, you have failed step one. But let's say you went through step one. After you've halted all inbound infections, what's step 1B? Well, that's face masks for everyone. And again, surgical masks even, not those really tight-fitting N95s, face masks, at least the ones without the valves on the front, which are the respirators, which have the valve for easy breathing out. Face masks for everyone means that sick people aren't then seeding the local area with their germs. So as soon as everybody has face masks, Hong Kong has shown, you can really get your arms around this and stop it. All right. So let me just pull this because all right, never mind. There's supposed to be a face mask for everyone right here. Forgot to transfer it over. Step two. What's step two? Step two is aggressive testing. That's after you've halted all the inbound infections. Later that same day, maybe in the same minute that you're doing this, you're also beginning a very, very aggressive testing program. So that rigorous, aggressive testing program, let's talk about what the opposite of rigorous might be. The governor of Texas, Governor Abbott, just announced very proudly, held a joint press conference, big presser, everybody standing around is important. They had the state health services commissioner there, John Hellerstedt. They had Texas Division of Emergency Management Chief Nim Kidd there. They're providing updates. So big, nice presser. Everybody got some good airtime there. And so sounds good, right? And then the governor also provided an update on Texas's first case of the coronavirus in Fort Bend County and assured the public that the risk to Texans remains low. Now, when you had to read down, I had to separate this article all the way at the bottom in the last paragraph. You know what I found? The State Public Health Lab Network will be able to test 125 patients a day once the entire network is equipped. So it's not even equipped yet. 125 patients a day. Is that 125 patients a day or is that 125 tests a day? Because some patients need to be tested more than once. But that's totally insufficient for a state that has a population in the many millions. This is the exact opposite of what we would be talking about with aggressive testing. All right. After you've made the aggressive testing possible and you're testing everybody, you got to make it easy and fast, right? You don't want to be sending it off to, the CDC and all of that. So where's the United States on this right now? Well, this isn't the gold standard. We're going to call this the tarnished bronze standard because I guess at least we have testing. But look at this. This is coming out of UNC Health Services. And I know that so the North Carolina Department of Health and Human Services, they can't come right out and say what's true, which is, look, we don't have that many tests. They might be in the same position as, say, Texas. They can only do 125. You got to ration those because you could probably find 125 people in any small city or even a large town that would say, raise their hands and say, I really want to be tested. My lungs don't feel good. Test me, please. Right? So I know they don't have enough testing, but instead of saying we don't have enough testing, they put out this following criteria to get testing. So they're making it hard, not easy, by saying, one, here's the criteria. One, recently traveled to a country with a CDC level 2 or level 3 travel health notice for COVID-19. 2, experiencing fever, so you're symptomatic. And 3, you also have to be experiencing respiratory symptoms. Individuals who meet all 3 criteria should contact their doctor or local health department. And then a clinician and a public health official will decide if a COVID-19 test is appropriate. They might deny you then. And you know why they would? Because they don't have enough tests. If we had enough tests, we'd be like, yes, test everyone. Because aggressive testing is really important. But you got to make it easy. This is the opposite of easy. You got to jump through all these hoops, and then you got to contact your doctor, and then the doctor is going to, have to, debate with public health officials, and they might take a test, right? This is really the exact opposite of a gold standard right there. All right. But it's not just in the U.S. Don't want to just be picking on my own country here. This comes to us from Tom. Hi, Chris. I'm in Switzerland. We have an explosion of cases 2 weeks ago. The first case, now almost 500. Case, cluster. Boom. That's how it goes, Tom. Our government won't test except shortage of breath and fever. Same thing right here. Took my kids 6 and 8 years already 2 weeks ago out from school. We have border to locked Italy, but the border remains open. Yeah, so same thing going on over there in Switzerland, which is violating all the basic steps of a gold standard pandemic approach. And by the way, you know how I know these are the gold standard steps? Because this is what Singapore has done. This is what Taiwan has done. This is what Hong Kong has done. Remember, Hong Kong closed the border with China really early on. And I remember so many column inches were wasted saying that's too much and that's really draconian and that's going to hurt their tourism industry. They didn't care. They prioritized human life over tourism dollars. And so that's why Hong Kong has a controlled rate of infection right now. All right. But could we go even further and make it as hard as possible? So here's a person, Justin, writing, I'm hesitant to share this because it feels really awkward, surreal to be in this position, but here goes. The new doctor has stated the only reason they haven't tested for coronavirus is they aren't able to get the tests. I know it sounds crazy. That's what she told us. Yeah, it does sound crazy, and it is crazy, but it's also reality right now. I showed her this post, explained to her what we've been through. She said lots of people are going through the same things. I'm trusting what she's telling us. She's pushing us again to be able to get my wife tested. Again, we don't know if that's what it is, but it's something viral. If she's unable to get the tests again, she's asked me to contact those on Twitter within the virology epidemiology community to help us out here. First things first, though, spinal tap, then review, determine next steps. So this poor individual here, Justin, his wife is very ill. They're just trying to get tested so they can rule this thing out, and it's a battle. And the doctor's trying to help them out with a battle, but this is the opposite, the exact opposite of making it easy and fast. This is making it as hard as possible. This is an absolutely broken healthcare system that treats people this way. And I'm not blaming the doctor, but the system itself is utterly broken, and we really shouldn't put up with it. We shouldn't. This is infuriating, not anger sometimes just as drama, but this is infuriating that we are treating ourselves this way in this country or other countries that are allegedly, up the curve and consider themselves to be first world. This is not first world behavior right here. This is banana time. Okay. After you've made testing easy, then you go through rigorous contact tracing. So you have to hunt down every single person who's been in contact with somebody who tested positive for this thing. And then you take all of those people and what do? You gotta find them right away. And one easy way to find them, of course, is you have to announce that you're going to pay for the test. People who think they're going to get slapped with multi-$1,000 bills often will evade you. You won't find them. They're not going to answer their phones. So you got to say this is free for the people who are being contact traced. The state needs to pick that up because otherwise, incentives being what they are, you're going to miss people, and you can't even miss a single person with a disease like this. You've got to find them all. That's what I mean by rigorous contact tracing. All of them. Everybody who was on the bus with a sick person and everybody who they came in contact with, right? That's what you got to do. All right. And then two other steps here. You got to pay for the treatment. So if they do get sick and you're putting them in the hospital, pick up the cost of the hospital. That's what Singapore's done. And then you got to pay for quarantine. If you're going to take asymptomatic people and say you got to stay home for 14 days or 21 days in the case of, I believe it was Guatemala's doing that. You got to pay for that because most people, especially in the United States, cannot afford to be taken out of action for a number of weeks like that. And then what's the last thing? You really gotta quarantine all exposed contacts for 14 plus days. Everybody. Those are the steps right there. And then finally, when you are treating people, you got to collect the data. You got to share it. We got a lot of great data coming out of China, and we got a lot of good data coming out of some other places. But this is important that people are treated to the highest level of standard, and then all the latest things that work have to be shared very quickly, very rigorously within the medical community. Well, what are some counter examples here? This is, fortunately, we have to go with the counter examples here. And let me see if oh yeah, sorry, I skipped one here. So remember I was talking about the contact tracing and paying for quarantine, and the quarantine has to be for all 14 days. Look what just came out of Sacramento County, March 9th, last night at 10 o'clock. Today is the 10th. So it's about 2:45 in the afternoon right now. Sacramento County is moving away from 14-day quarantines for people who have been in contact with someone with the novel coronavirus, officials announced Monday. In a press release, county officials said in an effort to slow the spread of COVID-19, it is no longer necessary for someone who has been in contact with someone with COVID-19 to quarantine for 14 days. This is a contradictory sentence. I can't even make sense of it. Let me change this word here. County officials said in an effort to help accelerate the spread of the disease, it is no longer necessary for someone who has been in contact with someone with COVID-19 to quarantine for 14 days. That's how that sentence should read. How can you even say this? This is not gold standard. It's not even tarnished bronze. This is caveman standard kind of stuff right here. This is 13th century monks, waving incense back and forth standard. This is closing your eyes and lifting your arms in front of the TV in hopes that the free shot goes in. I do that. So, okay, I get it. But this is superstitious, right? This has nothing to do with science right here. It's awful. Sacramento County, what are you doing here? And then they go on very helpfully to say vulnerable populations, including elderly people, people with chronic health conditions, are encouraged to stay home and stay away from crowded social gatherings and to protect themselves. Nothing about how they might get food or medicine or go to doctor's appointments or anything that sometimes elderly people need to do. This is called throw the old people under the bus because this is too hard. It's going to cost too much money. We don't know about this. This is indefensible. All right, just indefensible. All right. Anyway, so once you've gone through all of that, then you've got to treat and collect the data. So collectively, this is the gold standard pandemic approach. You halt all inbound infections. You do aggressive testing. You got to make it easy. People shouldn't have to jump through hoops, beg, steal, involve, bureaucratic officials just to get a test. Rigorous contact tracing, everybody out 1 or 2 hops from the infected person. You pay for the test so they don't avoid you. You pay for the treatment so they don't avoid you. You pay for the quarantine so they don't avoid you. And then you got to quarantine everybody who's exposed 14 or more days and then treat or collect the data. And around all of this, you have to put clear, consistent, transparent, and frequent communication. This is non-negotiable. This is absolutely vital that this is happening just constantly. What are some counter examples to that? I could find 50 a day if I needed to. So here's one from today, just from 10:24 this morning. HHS Secretary Alex Azar says surplus tests. Cuomo, governor of New York, says not so fast on that. That's not true. We now have a surplus of tests, said HHS Secretary Alex Azar during an interview on CNN Tuesday morning. They're out in the community. They're available to doctors and public health officials. At no time has a public health official who wanted to get an individual tested for novel coronavirus been unable to get them tested. That claim was immediately disputed by Governor Andrew Cuomo. It's absolutely false. So that's an example of very non-transparent, unclear, poor communication. And so that really hampers the efforts very, very badly. Or how about this? I pulled this off the WHO website just this morning. How long does the virus survive on surfaces? Well, it's not certain how long the virus that causes COVID-19 survives on surfaces, but it seems to behave like other coronaviruses. Remember, we pulled all that data out. There's that meta-study of 22 other studies examining other coronaviruses like SARS, the close relative of SARS-CoV-2, of MERS, another close relative, of HCOV, another fairly close relative. Studies suggest that coronaviruses may persist on surfaces for up to a few hours or up to several days. Okay, that's several. What's several to you? To me, that's 3, maybe, because 2 is a couple. 3, maybe 4. But we know it survives for up to 9 days. We have the data. Why not put that data out there? This may vary under different conditions like type of surface, temperature, humidity. Which surfaces? How does it vary with temperature or humidity? We have all this data. This is the opposite of transparent, clear, and consistent information. And this gets out there, right? And next thing you know, you're reading headlines like this. New coronavirus lives on surfaces for hours to a day, one expert says, right? This is false information, very bad. So if you're on a hospital decontamination team, you're a part of the sanitation crew, which has a very vital job of clearing and cleaning rooms twice a day so that they're not infecting other people, or you're clearing them out before a new infection comes in. if you read this, you would be forgiven for thinking, well, nobody's been in that room for 3 days. It's good to go. You'd be wrong, right? And you wouldn't know that you need to clean the steel surfaces a little bit more carefully than you need to clean the plastic surfaces, right? Or anything like that. So this is bad communication. Awful, inexcusably bad at this particular time in this story. All right, so what happens when you try and cheap your way through this? And by cheap, I mean, we're going to try and do this on the cheap, or we're going to not make, we're going to have to stinge on budgets. We can't find money for this stuff, oh, it's going to be hard. It's going to be politically expensive. So let's do it on the cheap. Well, this is what happens. Controlling the coronavirus outbreak in some parts of the U.S. is now beyond containment efforts, said Robert Redfield, director of the CDC. Okay, Robert, here's the thing. We never even tried. There were no containment efforts. A containment effort begins with this, progresses to this, has this as part of a component of it, and includes this, and this, right? We never tried that. Where did we try that? Where has this been available in the United States? Nowhere. So now beyond containment efforts, we didn't even have a containment effort. So let's just stop that language right now. And then Lisa Abramowitz, Bloomberg reporter, who I read quite a bit, said the window for containing the coronavirus is past in some parts of the U.S., says the CDC head, who acknowledged that the nation's failure to quickly roll out tests for the virus had impeded early efforts to contain it. It wasn't just that. It wasn't just the effort to that was a massive failure, but it wasn't just that. I know lots of cases of people who were claiming that they had just come back from an affected area. They had been begging for the test. They were pretty sure they had COVID, probably a good chance they had COVID. Nobody followed up with them. No, they said go self-quarantine, but nobody did secondary contact tracing. None of that happened, right? So Ben Hunt, I think he's right here. He's going to say, he says, we will look back at don't test, don't tell as one of the greatest policy debacles of the past 100 years. Absolutely right. I mean, it's just awful. All right, you know what they say, case, cluster, cluster, boom, right? Case, cluster, boom, right? That's where we're at, and this is now just striking the United States. We've got cluster. I think you know what follows next. New York is going to close gathering places in New York suburb. This just came out at 1:25 this afternoon, so it's a little over an hour and a half ago, my time. The National Guard is going to be sent into New Rochelle, a tony suburb of New York City, if you will, to close large public gathering spaces in an effort to slow down the spread of the coronavirus outbreak in the suburb of New York City, Cuomo said at a press conference, referring to the 1 mile square area as a containment zone. Good luck with that. Cuomo said the effort would focus on places where large numbers of people congregate, such as social clubs or places of worship. It wouldn't be necessary to include restrictions on movement, he said. Jeez, we're doing this on the cheap again. Look, if you really think you got a big cluster, you have to put restrictions on movement. This is half-assing it right here. If all you're going to do is prevent places where large numbers of people congregate, small numbers of people will still congregate. This is absolutely not how it's done, and we'll learn that, but we're going to learn it after the fact. You're not containing people, it's facilities. All right, parse that all you want, Cuomo, but this is absolutely a deplorable approach. It's indefensible. Gathering places such as schools and religious institutions within a 1 mile radius of highly impacted area of New Rochelle will be shut down. So good luck with that. But I think we know that this cluster we got a boom on the way already. So this is half-assed right here. What should be happening? Very simply, what should be happening right now is this: super aggressive testing, really, really vigorous and rigorous contact tracing. Make sure all of this stuff is happening right here, and then you have a shot at it. But pulling in the National Guard to just shut down large gatherings and not restricting movements, yeah, not going to work. All right. And Lenore L. Hawkins wrote, they are now doing what Italy did on February 21st. Now, just 17 days later, Italy has been shut down. I pray the USA doesn't experience something similar. I pray for that too, but that's not going to happen. With this sort of an approach, it's close to a guarantee as you can get. We're just behind Italy by just a matter of time here. And because we're doing the same things, not being serious about following the gold standard pandemic approach, which is something that really we're going to regret big time, I think. Remember, the balancing act, of course, is between stopping the pandemic, keeping the economy going, and keeping your hospitals working. So a lot of hospital officials out there right now are struggling with the idea of what are they going to have to do. And if you read into, not even read into, if you just read the Italian data, you find out that you may well find in a hot spot like they have in the Lombardy region that you're going to have to do triage. You can't treat everybody. You run out of ICU beds. You run out of ventilators. And so the question is, what do you do? And doing nothing is still doing something. So doing nothing is not an option if you want to help save lives. So this is going to be because so much of the United States and our leadership has been focused on this as a first and foremost thing. Too many people in positions of power were more concerned with keeping the stock market elevated, keeping everybody not panicking so that they could keep the economy going. Because there was so much emphasis over here, this got sacrificed, this got sacrificed, this is coming. So that's how I see this. But don't worry, in the United States, Trump is on the job. Remember I said, I can't remember if I said it in one of these videos. I certainly wrote it at my website at Peak Prosperity. White House likely to push federal aid for shale companies hit by coronavirus and international energy shock. Trump confidant and oil billionaire Harold Hamm lost $2 billion yesterday in that bloodbath in the stock market. Hamm reached out to the admin but says he didn't make direct contact. Oh no, won't someone think of the billionaires? By the way, Harold Hamm didn't lose $2 billion. He had $2 billion in unrealized gains in some stock that he was holding. Remember, folks, if you don't take money off the table, you can't lose it. All that happens is your paper wealth goes up or down. So, but at any rate, White House is on the job. Meanwhile, in a more compassionate and in-touch country, in Italy, Laura Castelli, Italy's deputy economy minister, told Radio Anch'io that yes, that will be the case for individuals and households. They are going to suspend mortgage payments amid the outbreak. Remember, if you want to have people honor your quarantines, you got to pay for the quarantine. So that's what they just announced in Italy. That provides big relief, I'm sure, for a lot of households. In the U.S., we're going to see if we can bail out some poor, suffering energy billionaires. In Italy, they're going to help pay for mortgages for people in the entire country. All right, or at least suspend the payments. All right, here was another really thoughtless idea that came out. And I'm not here just to bash on the Trump administration, but oh my God, just awful things coming out. So yesterday they floated this idea of a payroll tax cut after market plunged on virus fears, right? So that was at 6:30 last night. A payroll tax cut. So payroll tax, payroll taxes, you got your FICA, you got all that junk that comes out of your payroll. They're talking about a cut in that and not even elimination. But here's the question. What good does it do a waitress who's just lost her job because the restaurant is now closed because there's no traffic anymore? What good does it do her if you cut the payroll taxes on the paycheck she's not receiving anymore, right? On and on. The payroll tax just does nothing for people who are actually impacted by this, except if you do still have your job, it'll put a few extra bucks in your pocket every week because there'll be less taxes taken out. But oh my God, that just doesn't even get even remotely within. Like if we were shooting at a target with an arrow, this missed every ring and landed in a tree 30 feet to the left. That isn't going to cut it. Here's some better ideas. Make testing free for everyone. How about we start with that? Announce that right away. Make sure everybody knows that. Pay quarantine people a reasonable stipend or maybe take care of their mortgages or something like that so that quarantine people don't have to make the choice between losing their home, going bankrupt, maybe not in that order, and losing all their possessions and not breaking quarantine. Don't make people make that choice, right? Pay for any and all hospital costs of treating a SARS-2 victim, right? Suspend mortgage payments for everyone in a quarantined area. How about we provide food baskets to the elderly and maybe hand deliver their medicines to them so they don't have to go out in public? How about we immediately relax stupid pharma laws that prevent people from securing a 6-month supply of necessary medication, right? How about this? How about we suspend federal tax payments for all households and small and medium businesses for a period of time? These would be things that would go right straight to the people of course, we don't have a bottoms-up sort of a government. We have a top-down government that considers this to be a bigger problem than these sorts of things. All right, remember, if the facts alarm you, the problem isn't with the facts. I mention this again because we're about to come into what I think is a fairly alarming period of facts. The case, cluster, boom is about to happen. By the way, there's a number of things that I would like to point out. One is that when let's see, where would I put that? Oh, yeah, this one. So what got me really on the train of warning people and sending out an alert, it was finding out that Wuhan had been quarantined, meaning that they had immediately shut down travel in and out of the city. I saw that information January 22nd. I had an alert out on the 23rd because that's all I need to know. By the time the National Guard is being sent in to help quarantine an area, that's it. You don't need to know anymore. We're there. It's happening, right? Even though they try and soft pedal it, and it's like, we're not containing people. It's facilities, those darn facilities. That's not the issue here. So that's all you need to know. That's all I need to know. It's about to get a little bit alarming. Take deep breaths. If you've been preparing, keep doing that. If you can help other people prepare, please do that. We're all in this together now going forward. It isn't us versus them. Now it's up to us, those of us who see this coming, who have seen it coming, to do what we can do. Here, remember, it's not the flu. It's not SARS. We've got the big list here. I'm just going to keep putting this up in case anybody hasn't seen it. Remember, there's lots of ways to avoid being infected or becoming infected, and it really starts with social distancing, large or small. Just avoid them. Just avoid gatherings. Just do what you need to do. Once everyone is wearing a mask when out and about, this can be relaxed a bit. All right. Again, not that many conclusions for you today because I wanted to really focus on the difference between gold standard pandemic responses and those that are being seen in the OECD countries. So those gold standard responses mostly missing from those countries in the OECD, which includes the US, the UK, pretty much the rest of the EU. Essential time was wasted trying to get people to not panic, whatever that means. I still don't know what that means. It's like, don't panic. We don't want people panicking. I'm like, what would panic look like? What's so terrible? Like, tell me panicking, right? And people usually go blank because they don't know what that means when challenged like that. But I guess they mean we wouldn't want people buying things in a panic. Well, listen, is it the emotional state or is it the buying things? Which don't you want people to do? Because normally we want people to buy stuff, but we just don't want them buying more than they usually would. So it's really unclear what that all meant. And because we spent so much time trying to get people to not panic, we've thereby assured that they actually will panic when the boom comes, right? And it will. It's coming. That's just the nature of these things. That's how exponential pandemic disease progression works. Remember, if you get unsubscribed, just resubscribe to this channel. It's happening a lot. Twitter and Google are doing their level best to make sure that this message reaches as few people as possible because they're really busy working with the government as much as they can to assure that only official messages get out without taking the time to notice that they have a responsibility as citizens, as a company of the nation, that when your government is failing badly, the duty no longer comes down to making sure that the government still has the only messaging out there. So thank you very much for listening again today, and good luck. And really, it's time to make sure you get all your preparations up as much as you possibly can because that boom is coming. That's the way I see it right now. Nothing in the data has changed that at this point in time. Good luck, everyone. And remember, take this message calmly and helpfully to as many people as you can. That's your responsibility as people who understand this message. Bring it to your local town councilors if they haven't thought it through. Help them think through plans of how the elderly in your town are going to be helped and served. Help them think through what we can do around MacGyvering our way through mask shortages and thinking things through, and understand that anybody who has got this and who has become cleared of it is 10 days post-symptom, you are going to be worth your weight in gold because we're going to need you to help in lots of situations where you no longer require masks and you no longer require other PPE. People who have got this and recovered are going to be needed, especially in those first 4 to 6 weeks when this thing peaks, and that'll probably be April, May, June, somewhere in that zone. Okay, so with that, I'm signing off. Thank you very much for listening. We'll be back tomorrow.
Hi folks, Adam Taggart here. Chris Martenson and I are the co-founders of Peak Prosperity. If you want to get alerted whenever we release a new video from Chris, just click the red subscribe button right beneath the YouTube video player. Once you've done that, a little bell icon will appear right next to it. Click on that bell. It looks like this. And that's it. The next time we publish a video from Chris, you'll immediately receive a notification from YouTube. Thanks for watching our videos.